people have fulminant hepatic failure, just remember the liver stops functioning. I'm going to use this time now to talk about what the liver does, okay? Because in order for you to understand liver failure, you have to know what the liver does first, so you know what's not happening, correct?
Yeah.
So where do you find the liver? In what quadrant, sir?
The upper quadrant.
Which one, left or right?
The left.
No, the right.
The right. Oh.
All right, make sure you remember that, okay? Because look, I'll draw it up here too. This is the quadrants, and the liver is found on this side like this.
Oh.
You see? And the stomach would be kind of like behind it.
Behind it.
Like that. That's an ugly stomach, but you get the gist. Oops. That's the liver, right upper quadrant, number, right upper quadrant. When you look, and I think you have to remember when you're looking at the patient. I know you're looking at the left side, like when you're looking, but it's their opposite side. So just please take your time. Yeah, take your time to.
But if I'm looking at myself,
it's the left side. I'm sorry. Yeah. When you're looking at the patient, if it's on the side where your left hand is at.
Yeah.
Okay, but it's the patient's opposite side. So please take your time to organize that in your mind so you won't make those simple mistakes, because you know it. It's just,
Excuse me, sir. So when the question is asked, I cannot use myself.
That is correct.
I will only use the patient's.
That is correct. The patient's record.
Okay.
And do you remember the anatomical position?
Of course, yes.
And that's why they always said when you're the patient's in the anatomical position, you know, they have their hands like this and their hands, I'm just gonna draw it like this real quick. Because our thumb, this is how we're gonna be assuming that our patient is standing every time we're addressing anything. You know, their thumb is on the lateral side. You know, there has to be a specific area. So again, this is the patient's right side, this is the patient's left. So it's different from ours because we're looking at the patient, you know, and if we're trying to grab the patient, let's say this is our hand, this is our left hand.
Yeah, of course.
But it's the patient's opposite.
It's
so
opposite.
just
Oh my God, I got it now.
You got it now? Okay, good. I'm glad. Good. I'm happy about that. Because a lot of times, Mr. Tayo, it's very small things that cause you to misunderstand more things. But as soon as you fix the small detail, everything else starts making sense.
Good. When I read a question, I always put it to myself.
Yeah.
So when they ask of where the liver is, I look at my eyes. Instead of saying the left position, I will not put it to myself where it is on my own side.
Yeah.
I got it. Thank you, sir.
Yeah. Thank you. Okay, so now let's talk about functions of the liver, right? Okay. The liver provides a lot of functions. Listen, without our liver, we can't live, okay? Remember, we already said, what's the one thing that you already do know about the liver, about what it does?
Detoxifies.
Beautiful. It detoxifies blood, right?
Yeah.
It removes all the waste. And do you remember how I discussed that the entire GI system takes all the blood to the liver so it can detoxify it?
Yeah, yes, I remember.
Well, keep this in mind also. It's not only the waste that it's taking, it's also taking nutrition. So I want you to know the word synthesize.
Okay.
Synthesize means it manufactures. It synthesizes proteins.
Okay.
Let me give you a little bit more background in this so it can make a little bit more sense, okay?
Okay.
When you eat a piece of chicken, let's say, right? You eat chicken, right?
Yeah.
And as you start chewing it in your mouth, you start breaking it down. And then eventually the proteins in the chickens, they're known as amino acids. Amino acids are essentially the building blocks of proteins. Does that make sense, Mr. Tayo?
Yes, sir.
So in our body, we have a lot of proteins. We already talked about You know that hemoglobin is a protein?
Oh, yeah.
Yeah. You know that enzymes are proteins?
Yeah.
You know the fibers of your muscles are proteins. The elements that keep your fluid, whether it's supposed to be, is called albumin. That's proteins. I mean,
Yeah.
there's so many proteins, Mr. Tayo.
Wow.
Well, the chicken that you eat, they provide a variety of amino acids. There's 21 types of amino acids.
Wow.
Okay. And your liver can rearrange all those 21 however it wants to create hemoglobin, to create enzymes, even to create white blood cells. Have you ever heard of immunoglobulins? That globulin part is a protein. So my point is the liver is responsible for all of that. Does that make sense, sir?
Yes, sir.
The liver also deals with the metabolism. And metabolism is a fancy word that they use to describe how your body puts something to work, how it utilizes it. So it's responsible for the metabolism of carbohydrates, meaning sugar.
All right.
Okay.
Yes, sir.
You got that?
Yeah.
Okay. Your liver also helps with clotting. Have you ever heard of vitamin K?
Yeah, vitamin K.
Not potassium, right? Vitamin K. And do you remember that we get vitamin K from green leafy vegetable? Remember that?
Yes, sir.
And so I don't know if you remember, but vitamin K helps you clot. Do you remember that? Well, when you eat vitamin K and green leafy vegetables, all the veins from the GI system, they take the vitamin K to the liver, and your liver makes clotting factors, which are building blocks to clot off of vitamin K. Does that make sense?
Yes, sir.
It also creates white blood cells. Remember those immunoglobulins that I was talking about? Proteins. So it helps with the immune system. It also, I know we said detoxifies blood, right? Let's be more specific. It detoxifies urea. I'm sorry. Let me take that. Let me say this again. Hold on. You know how we discussed that chicken, you chew it, you break it down, and it becomes amino acids?
Yes.
Every time your body destroys anything, when it breaks anything down, it gives off waste.
Okay.
The waste that's created when we break down proteins in our system, that waste is called either ammonia.
Okay.
And so the liver takes that nasty ammonia and it converts it into urea so it can go in your urine and you can pee it out. Does that make sense, sir?
Yes, sir.
Your liver also, there's so many things it does. It also rids blood of bilirubin. Now, bilirubin, you should know, is yellow.
Yes.
And that's important for you to know because when you have liver cirrhosis, when your liver's not working, what color does your patient's skin get?
Yes, sir.
What color does it get?
You mean
when someone has liver issues, what color does their skin get?
Yellow. It gets yellowish.
What's it called?
Like
remember jaundice?
Jaundice, yeah, that's why I say yellow. Yeah, like
yeah. So jaundice, that's why people get jaundice when they have liver failure, because their body cannot get rid of bilirubin. And let me elaborate on that. Bilirubin is RBC waste.
Wow.
Okay. Do you have children, Mr. Tayo?
Yes, sir.
Did any of your kids have jaundice when they were born or at some point after they were born?
No.
Okay. My son had jaundice about 2 days after he was born. The reason why our children, when they're born, and you're gonna have to know this when we get to pediatrics.
Yeah.
The reason why babies have jaundice sometimes is because there's RH incompatibilities, meaning that the mom's blood and the baby's blood don't match. So at some point, the mom's white blood cells attack the baby's red blood cells and destroys their blood. And when you destroy the blood, what color comes out?
Yellow.
Because of the bilirubin, right? And
Yeah,
that's why they develop jaundice.
Jaundice, okay.
And when we get to it, we'll talk about expected jaundice or physiological and pathological, which is bad. But we'll get to that later. Okay. I'm gonna pause here real quick and to let you know this is what the liver does, Mr. Tayo. There's a lot of stuff that the liver does. Okay. It detoxifies blood. It makes proteins, in particular, a protein known as albumin.
Albumin.
Okay, which regulates fluids in your body. Okay, it regulates fluids in your body. Do you walk around with edema?
With edema?
Do you have edema right now?
No.
No. Does your wife have edema? No. Do your kids have edema? No. Why? Because we have albumin. Our albumin keeps the water in our body in its respective compartments. It keeps the water in check. Does that make sense, sir?
Yes, sir.
So you can imagine how important the liver is. Metabolism of carbohydrates. Your body, your liver stores sugar as something called glycogen.
Glycogen, okay.
And then when it's time to increase our blood sugar, it converts it into glucose.
Glucose. Wow.
And now we can absorb it with the help of a hormone called glucagon, which we'll discuss later. That's the endocrine system. The pancreas releases hormones that increases blood sugar. That's how it does it. It converts glycogen into glucose. Our liver also helps us with clotting factors, meaning it helps us clot by the utilization of vitamin K. It helps create white blood cells, immunoglobulins, so it deals with the immune system. It helps detoxify protein waste, such as ammonia. It converts it into urea, and we pee it out in our urine. It rids the blood of bilirubin, which is yellow, and it's caused by every time our red blood cells are being broken down. Does that make sense, sir?
Yes, sir.
A lot of information. I understand that.
Of course.
All right. Now, let's get out of here, and let's see if we can play with this question. It said... Sorry, it logs me out after inactivity. So. Okay. But today my internet's working just fine. Sometimes it's very faulty. All right. This says, a nurse is assisting with the admission of a client who has fulminant hepatic failure. Which of the following procedures should the nurse expect for this client? Now, what do you think that this patient is going to have as a procedure?
I would say hepatic failure. That means I would say
and with this one you really have to know this one doesn't cause remember how let me explain something real quick. When you have liver failure, what does liver failure and ammonia have to do with? Do you remember? Have you ever smelled ammonia?
Yes.
It has a really bad, strong, pungent smell, right? I want you to associate ammonia as being that nasty, pungent odor, okay? But in a healthy person, what does the liver do with ammonia?
it turns ammonia to urea, which
That
also
is correct.
turns into urine.
And then the urine, right? That's right.
Yeah.
See, you're good. You're good. You remember this, right? Now, my point is this: ammonia has that nasty, nasty smell. If you have if you have hepatic failure, can you get rid of ammonia?
No.
The ammonia level starts to increase in your blood.
In the blood, yeah.
Okay. And that causes a problem with your brain. Because now your brain cannot communicate with the cells because there's so much ammonia. This is known as hepatic encephalopathy. Okay. So this question says, a nurse is assisting with the admission of a client who has fulminant hepatic failure. Which of the following procedures should the nurse expect for this client? We've already addressed that patients with hepatic failure could develop hepatic encephalopathy, correct? At the same time, if the patient has hepatic failure, remember how the esophagus was sending all those veins to the liver?
Yeah.
And then if the liver is not working, then it can't receive it and it starts backing up.
Of course.
So that causes esophageal varices, correct?
Yes.
That's another potential issue with hepatic issues. So this question is just asking you, what do you think is going to be the treatment? What procedure? Endoscopic sclerotherapy, liver lobectomy, liver transplant, or transjugular intrahepatic portal system shunt placement, which I'll discuss in just a bit. Take a guess, Mr. Tayo.
I would take D.
D. Final answer?
Yes, sir.
Okay. With this one, it says transjugular intrahepatic portal system shunt replacement.
Oh,
hold on. Because of the way that when somebody has fulminant hepatic failure, the liver is being destroyed. A large portion is being destroyed. There's no hope for this patient. So they need a liver transplant. However, you were not bad with transjugular intrahepatic portal system shunt replacement. I'll explain why it's not that answer in just a bit, but a transjugular intrahepatic portal system shunt is placed to treat esophageal varices specifically. Through placement of a stent into the portal vein, the stent serves as a shunt between the portal circulation and the hepatic vein, thereby reducing portal hypertension. Let me show you what that looks like. Okay. So, oops. Okay. And then you have the liver right here, right?
Yes, sir.
Okay. Where's the liver located again, sir?
The right upper quadrant.
There you go. That's good. And so you have the liver right there, right? And you have the esophageal varices, which I'm gonna make them a little thicker now because they're thick now. Okay. And they're all going in here, and so it's backing up. That's why they're so thick. Correct?
Yes, sir.
What we do with since the hepatic portal vein, this one right here that I'm shading in, it's congested. What we do is we reroute. We get how do you explain this? Let me see. It's a catheter that goes from the hepatic portal vein, from right here, and we take it back to the jugular veins. The jugular veins are on the side of your neck, which are not part of the esophageal varices, okay? They're different vessels. They're right here on the side right here. And that goes straight to the heart. So in theory, what we're trying to do here is the blood that's normally going to the hepatic portal vein that's, obstructed, we're rerouting it. We're making that blood we get that blood, we put a catheter that connects the hepatic portal vein to the jugular vein. So all that blood that's going this way from the jugular, from the esophageal veins, we're rerouting it back to the jugular vein, because in a healthy liver, when that blood goes in here, eventually it goes back to the jugular veins. It goes to the heart again. But right now, since the liver's blocked off, we're creating a shortcut. Does that kind of make sense?
Yes, sir.
Okay, you don't have to know the anatomy of it. Just know that we're redirecting that blood that would otherwise go to the liver. We're creating a shortcut for it to go back to the heart through the jugular vein, which eventually goes back to the heart.
Okay.
Make sense, sir?
Yes, sir.
But that's specifically for esophageal varices. So the veins in the esophagus won't be dilated and things like that. Make sense, sir?
Yeah.
Okay. Sclerotherapy is going to be for also esophageal varices. Now, this is something that we're going to be learning, because remember how I said that if they're looking for one answer, but two answers say the same thing?
Of course.
You can, but do you see how that trick does work?
Yeah.
Okay. Sclerotherapy, Mr. Tayo, is when somebody has, the jugular veins, like any vein, and it's incompetent, meaning it's not functioning well. The valves that are inside are down instead of up. So this vein no longer functions any service for us. So what we do is we inject a solution into it that's called sclerotherapy. And eventually that vein that's damaged dries up and it goes away. Does that make sense, sir?
Yes, sir.
That's what sclerotherapy is. We do it, though. It's called endoscopic because this is because if you can imagine, this is the oral cavity of the patient, let's say, and this is the esophagus. I can't draw them out that well, but you get the gist. Okay. We put a scope inside, a scope that goes in here like this, and then we have little we have all the esophageal varices right there, right? That scope can inject a solution into the veins, which will fix the veins, meaning it'll help them reabsorb and they'll dwindle. They'll go away. They'll be eliminated. Does that make sense, sir?
Yes, sir.
That's what sclerotherapy is. So my point is that this fixes esophageal varices, as does this one. So that's not going to fix the actual liver failure. It's only going to affect those things. Lobectomy only removes a portion of the liver, but when you have this type of fulminant hepatic failure, the entire liver is affected. Does that make sense, sir?
Yes, sir.
Okay. So check this out. This is what I want you to know about the fulminant, is that it affects the entire liver, and it's usually secondary to hepatitis. That means that the liver's been being destroyed little by little throughout the years. That requires a liver transplant, not anything else. Does that make sense, sir?
Of course, yes.
All right, good. Okay, Mr. Tayo, my apologies, but I forgot I have to go into work at 1:30, and I'm not in Riverside where I'm usually at. I'm going to cut it a little short, but I will definitely give you the 10 minutes next time. Is that okay with you, sir?
No problem, sir. Thank you so much.
Okay, thank you so much, Mr. Tayo. Look, how do you feel?
I feel good. I feel I'm getting better, I think.
I think so too. The goal is to create that foundation. Don't be discouraged, because there's a lot of information that we covered that you don't necessarily have to be proficient in. You do have to understand the basic concepts. And that's why I'm going over and above the explanations. I will email you this